In this video, I'm going to show you how to tab tape for peripheral ulnar neuropathy in the elbow and in the hand. In the hand, it's called it's called tunnel de Guyon syndrome or Guyon, and in the elbow, it is called the cubital tunnel syndrome. So I'm going to show you a couple different ways we can use something like this, leukotape plus cover roll, to actually help assist move the nerve away from compression sites. Now, something I've already done is I taped into here, which is actually, this is the cover roll. It's really, really needed in order to not create a bunch of skin irritation. But basically the way I set it is we start here, because this is the cubital tunnel right here. So the cubital tunnel, a lot of times the ulnar nerve will actually flip. It'll flip this way when you have elbow bends such as this. So typically I start like this and try to get the person to have symptoms with that ulnar nerve flipping, and then we put this tape on as a way to first cover the skin before we actually tab tape. In the process with the tab tape, we're actually going to put the anchor point on, and then we're going to move it around while we do the test to see if we can have a definitive change. But the reason why I do it in this manner is because it's more comfortable when we actually have elbow bend, plus we can do the test and not have a lot of wrinkles in the skin and in the tape in the process. Now, the first thing to do with tab taping is really that we need to make sure that we create the tab system. So this is leukotape, like I showed you before. I usually take about a distance about this far, and then we rip it off. And you might be wondering, can I do this with other types of tapes and so on? No, not really. I haven't seen any way to, but if you did find a way, I would love to see it. But the other tapes are just too stretchy. Like this one is really, really not stretchy at all, and it sticks really well to itself. So what I've done is I've formed this tab right here, and the point of the tab, and I'll show you right here, I'll stick it to this bench, is the point of the tab is that we can move, if you can see, it's kind of pulling up a little bit of the vinyl right there in either direction that we pull, and when we test this, we can actually test to see what's the more comfortable position for the patient. So I'm going to put it on an aspect of the cubital tunnel right now. Okay, so like I said before, this thing typically flips this way. So what I like to do is, actually I didn't make this point far enough over here, but I'm going to go with it anyways since we're just doing a demo video, is that so at this point, if I can get everything nice and flush and pinned down to this cover roll, then I can use this as a pulling point. You see that it's pulling my skin this way or even a little bit this way, but usually you have to go this or this way if you decide to pull it down like this. But what I typically do is have the person bend their elbow like this, and there's a test, an orthopedic test that we do with this, which basically will show symptoms. So after they start to feel symptoms, I typically pull this one first in this direction to see if it decreases it. If it does, I'm going to tape it in that direction along the whole distance of this cover roll. Okay? Obviously you can see that I'm pulling a little bit further than I want to, probably because the cubital tunnel's right here. I should have started this a little bit more towards the elbow crease. Now, if that doesn't work, we can pull the other direction, or we can turn the tape and pull this direction as well. In this case, this works a lot for me, so I'm going to pin it in this position so we're relieving pressure off the ulnar nerve as it passes through the elbow. Okay, let's start with just this small piece, and this is going to be pretty hard because I'm doing it on myself, but I don't know if you can tell how sticky this stuff is, how sticky, how firm it is. You have to be really careful when you put it on, because if you let it stick to itself, it's not really going anywhere. So we're going to start here, and I don't think I've ever taped my own elbow, so this is going to be a new experience. So I start right around here, and we still have the tab right there. So this will catch the tab. I want to make sure it lays down, and now I'm actually on the tab right here. You can see it's flush with it. So what I do from that point is just basically bend the elbow here into the test, and I'm going to lift just so I can do it to myself. Then I'm going to pull across and lay that tape down really nicely. You can do this for about 2 or 3 layers. This is one, and let's see actually if we hit the point. So this isn't too bad. But what actually, if I left this with a patient like this, it would eventually irritate the skin because this is so tacky. So ideally what I like to do is this cover roll ends right here. I like to trim it off before I let them go. Now, to keep this thing in really nice condition and let it last for 3, 4, 5 days even, you have to make sure that when you are bathing and showering, just make sure don't tear away at it. You just kind of dab it dry and let it air dry after that and so on. But this can last quite a while, and it can provide a lot of relief. I've used it on quite a few things on my own. So this is how we tape for cubital tunnel syndrome or numbness that goes into the 4th and 5th digit. Moving on to the tunnel ligation, it's right up in this region of the hand. Okay, so I actually a lot of times put it right over it, and I've already done the cover roll so you guys can see. It wraps around the back of the hand, and sometimes you have to go a little bit more towards the thumb here, based upon which direction of pull improves it. So a lot of times people they end up having numbness into these 2 fingers right here. So if they do have symptoms, a lot of times it's a great thing, then you can test them. If we've isolated the injury down into the hand or the elbow, these are the ways that we can really test to see if it makes a difference. So what I typically do is put it right over the top of the tunnel. I pull to the side. Hey, does that improve it or not? Why, yes, it does. No, it doesn't, and so on. If it doesn't, then I might pull the other direction. Hey, does that improve it? So I'm trying to show you guys without the camera taking the view. But you see it pulling even on the this section of the pinky with so much tension on the tape. So depending upon which direction hurts, we take it and we lock it down that direction, very similar to what we did with the elbow as well. So keeping in mind that if you have to go a little bit further this way, you might want to make sure you have a little bit overhang because you don't want to get this stuff on your skin. My dad actually had he had it on his ankle, and it wasn't for me, but it didn't have any coverall, and he ended up losing the whole top layer of his skin. It was just a whole 3-week process to heal up. So this is how you do it with the tunnel of Guillain in cyclists or handlebar palsy.